Hi folks, it's me, Dallas. So, I don't even know how many subscribers I have on here. All I know is that I haven't posted a video in a very long time. Uh, my life's been pretty hectic lately. I'm actually living in Delaware right now, of all places. I'm doing a co-op for school. I'm working at a children's hospital. So, uh, YouTube and videos and all that, as much as I've kind of been wanting to do it, I haven't made a priority. Maybe I'll make some more if people actually want to hear me talk. So, anyways, I'm going to try not to talk too much about my actual life in this video because there are more important things at hand, like the fact that today is my 1-year post-op for my top surgery with Dr. Hugh McLean in Mississauga, Ontario. I know someone fairly recently asked me to do an update video. I waited until now to do that, so I guess the lighting's not too great right now because it's almost 9 o'clock at night, but I'm gonna show you and hopefully you'll be able to see. I might have to take some photographs so that you can actually see what's going on. So this is my chest. 1 year post-op to the day. So as you can see, it's not too bad. No dog ears or anything. Just as Dr. McLean said. Sorry, I'm gonna lift this up. So my scars, I think they've stretched obviously since what they were like at about a month post-op, which I think was the last video that I made. It might have been 6 weeks actually. But overall, I'm very happy with them. They're a lot better than a lot of the people that I've seen, which I don't know if that's just the nature of my skin and my body, if I scar decently, because I don't have too many big scars to compare them to, or if that's because I don't work out or do as much physical activity as a lot of people because of my cerebral palsy. But overall, I'm very happy with them. This side is very, very thin at the end, which it always was, and it never seemed to stretch out. Right in here is very white. It's more raised than the rest, but it's still very white. This bit, which I had more of like a fold or like a pucker, it's still there a little bit, but it's gone down a lot, and it's not noticeable from far away at all. Which I think most of that was just waiting for the swelling to go down, which took a very long time. I've been using a few different like scar treatments on my chest. The first thing I got was Invicable Scars. It's spelled like invincible but without the N. I don't know if I ever talked about this before, but it's fairly expensive. It's vitamin C based. I don't remember if it has silicone in it or not. But basically, vitamin C is supposed to be really good for your scars and really good for healing. So I took that and I used up an entire bottle of it. I think it was like the smaller size. There were two sizes, a really small one and a really large one. This was like almost a year ago that I used that. So I'll try to link to it. I think it worked fairly well, though how much of that was just the rubbing motion of applying this cream every day, or actually I was doing it twice a day for the good part of probably a month or two while I was remembering to do it. I think the rubbing action really does help, so if you're rubbing something, it's better, but the biggest issue I had with that was that it was getting staining on my bed sheets, when I was finally able to lie on my chest after healing, there was this kind of, almost looked like rusty on the bed, and it came out in the wash, but nobody really warned me that that was going to happen, so people might not want to use that all the time like I did. But the thing that really brought the swelling down was this. So what it is a DMSO cream, and it has aloe vera in it, and it's rose scented. So it's a 70% DMSO, 30% aloe vera cream. It's just white. So you have to be careful with this, because if your hands aren't clean or if you have anything else on the skin, the DMSO will take it into your skin very quickly and easily, so you really want to be clean when you apply this, but it is amazing for taking down swelling. I noticed within one application of putting this on that this scar and that fold that I was talking about had decreased significantly, and both sides are a lot more equal now because of it. So that's amazing. The other thing that I've applied is coconut oil, which it's the kind that smells like coconut. It's not bad. I kind of smell like a giant Bounty bar, but that's okay. Yeah, I just rub it on occasionally whenever I feel like doing it. I haven't really, sometimes I'm really good day to day putting it on, sometimes not so much. But one big thing that I'm not sure about if the oil is helping or hindering in this process is with my nipples. I find ever since surgery, my nipples get pretty dry and sometimes get flaky, so I was putting the coconut oil on them, but then I started developing kind of this white bump on this nipple, which was pretty uncomfortable, even though I couldn't really feel it, but eventually it was very large and was sticking out and gross, which I thought that it was solid and was just discoloration of the nipple, but actually it was like a zit, which no one had ever talked to me about this, and the fact that you can get these like zits that are kind of like underneath the graft of your nipple. But Chase was talking about this just this week in his 11-month post-op video, so that was good. It would have been good to know that that happens to other people, probably like in December, but it's okay. I ended up popping it with like a needle, which maybe I should have gone to the doctor, but I am from Vancouver, so I couldn't just go and see Dr. McLean, but I think it looks better now. There are still kind of like these little white bumps on both of them, kind of on the undersides of the nipples, but they don't hurt, and sometimes if I like squeeze the nipples in the shower, then some like pus will come out of it. I don't know. It's kind of, it's not even like pus, it's more like built up like dead tissue and lymph. It's kind of gross. I don't like talking about it, but anyways, both of them are really great. I have good feeling in both of them. Like I can feel touch. It's not like a sexual feeling, but they both get hard with touch. And I'm happy with the shape. The scarring around them, there's like this light pigmented scarring, but it's not very raised, and from a distance, again, you can't see it. So yeah, this is my chest, 1 year. Basically, I just want to say that, so I'm genderqueer and I'm non-binary, and this was the best decision that I have ever made in my life. Better than what I decided to major in school and where I went to school and just all the other big things that have impacted my life that are decisions that I made. This is the one that really just makes my life so much better. If there's any cis people watching, I gotta say that transition-related surgeries, a lot of times people try to say that they're cosmetic, especially like insurance companies and stuff. But this surgery for me was medically necessary and it was life-saving. I know that I would not be here if I hadn't been able to get this surgery. And so I'm really lucky that I was able to see Dr. McLean as a non-binary person and have my gender respected and have him and his staff treat me so well. I can't recommend them enough as a surgery center and team to other trans folk. Personally, I couldn't be happier with my results. They're only going to get better. And for a long time, I thought that to be happy with my results, I had to go to Dr. Garamoni. That's true for a lot of people, especially for people that are from the US. But if you're Canadian and you can go to Dr. McLean, especially if you're paying out of pocket like I did, he's awesome. It's up to you what surgeon you go to, but I loved my experience with Dr. McLean. So I guess this is getting really long. I'm going to wrap it up. If anybody has any questions or wants to see more, let me know. If you want to hear more about my life and not just my chest, let me know. I'll make more videos. I actually have a lot more spare time right now than I did when I was doing classes. So for the next 4 months or so, who knows, I can make a lot more videos if I know that people are going to watch them. And lastly, if there's anybody watching still, if you're in Delaware or Maryland or New Jersey or anywhere around here, hit me up if you want to be my friend. I know very few people here, and I could use some trans or queer people to hang out with. So the other thing that I forgot to say is that I'm going to be at the Philly Trans Health Conference in June, so if anyone is going to be there and you recognize me, say hi, because that would be cool. I'm going to be there with my partner Mark, who's in a few of my other videos on the channel, and I think when I was listing places where people are from there, you should become my friend. Philadelphia, and probably the rest of Pennsylvania, even though I only have the access to public transit to get around. I would love to meet more people. I'm here until September. So, yeah. If you're going to Philly Trans Health Conference, it's gonna be awesome, I hope. I've never been. Being on the East Coast, there are some perks. Okay. Now I really have to go. This is getting far too long. Okay. See ya.